Hello, everyone. Thank you so much for watching our podcast. We really appreciate it. Welcome back. I'm Dr. Towfighi, and today we have a guest from Capital Periodontal Group, one of our partners, Dr. Khalid Rasheed. Welcome, sir.
Thanks for having me.
Thank you. Today we're going to be talking about gum disease again and different options of treatment that's available, but particularly there's a specific procedure that's been around for some time now, and it has changed the way we do treatment. And Dr. Rasheed is going to be talking about that today. How you doing?
I'm good. Thanks for having me.
I know we've had a hard work day today, and thanks so much for taking the time to
Anything
meet with
for
us.
you, Doc.
Thank you, sir. In our previous episodes, we've talked about gum disease, periodontal disease, and what it means, the causes. We've gone through that
Sure.
and, for our listeners. But I want to go back and talk about a little bit of the treatments that are available today. So just a little bit, if you can tell us, what is pockets? Somebody comes in, I'm a patient, I go to an office, they say, you know what, sir, you have some pockets. Just let us know what that means again, one more time.
Absolutely. A pocket, to really sum it up, is a sign of bone loss. When we make a measurement, it's important to know that when you make any measurement, you need a point A and a point B, right? So you're a certain height because we measure from your feet to your head.
Are you messing around about my height,
Nah.
sir? Okay, go ahead.
Hey, we got to distinct, the two marking points, right? Point A and point B. So in a pocket, the point A is going to be the gum margin, where the gum meets the tooth, and then the point B is going to be where that bone level is underneath. So if there's inflammation, if there's gum disease, that bone is going to recede, compromising stability to the tooth, and then of course that pocket's going up. So when you're with your hygienist or with your dentist and they start collecting numbers and you hear numbers, generally speaking, anything greater than 5 or greater, we start to become a little concerned.
Okay, good. Very good. So now that the audience know or the listeners know what the pocket is, we've talked about also different ways to reduce this pocket because we've said if you have deep pockets, bacteria kind of sit in there and they do all their damage.
Exactly.
So we've had different treatments that we talked about before. One was what we call non-surgical, which is basically deep cleaning. And the other one was basically surgical. Now, this new procedure that we're going to be talking about today, which is called LANAP, it's a protocol which I want you to kind of go over with for our listeners to see what it means. So if you can maybe tell us a little bit again about surgical and non-surgical so people understand that we have two different modes available, then you can kind of go into the LANAP protocol.
Yeah, absolutely. When we're looking at non-surgical and surgical therapies, like you said, non-surgical is basically it's deep cleaning. We will do scaling and root planing, trying to remove all of the foreign bodies, and that's just a fancy way of saying plaque, trying to remove that because that's kind of a harbor for bacteria. Underneath the gums, it's warm, it's dark, and it's moist. And bacteria loves warm, dark, moist. So that's a perfect breeding ground for them. So depending on the severity of the pockets, we may elect to say, hey, you know what, non-surgical therapy could be beneficial to you. And so that's one avenue. If we need to go in a different route, we may suggest surgical therapy. Now, within surgical therapy, LANAP, what we're here to talk about today, does fall under that category. And for those out there, LANAP is spelled L-A-N, as in Nancy, A-P. And that stands for Laser-Assisted New Attachment Procedure.
Big words.
Very big words, right? So just say LANAP. It's really just say laser at its own point,
Yeah,
right?
exactly.
But really, what it comes down to is looking at the surgical options if we feel like that the non-surgical are not going to be beneficial, and so we have traditional surgery, which has been around for a very long time, probably approaching 100 years now.
Yes.
Wow, that's amazing.
That's a long time.
Yeah, seriously. And then the laser-assisted LANAP protocol, which has been around, I can't say specifically, but at least 30 years probably now. Yeah. I think it was kind of developed in the early to mid-90s. And I may be incorrect on that, but when you compare it to traditional surgery, it's definitely an infant compared to the traditional way that we've been doing it.
Very good, very good. So laser-assisted new attachment procedure. Why this procedure come out? Why did they even come up with a procedure like this versus we've had surgery that's been working for years, for 100 years, let's say. Why this? What was the reason for this?
That's a great question. I believe the developers behind it are dentists, so that's always
a good thing.
That's always it's always encouraging when you have people in the field also trying to develop the technologies that we use as opposed to a third party trying to develop a technology and then say, hey, use this.
Yes.
Right. So, I mean, that was important to me that we had someone within our own field kind of develop it. But plain and simple, the idea behind it is that it is less invasive. I mean, if you were to sum up the LANAP protocol compared to traditional surgical procedures, it's less invasive.
Yes.
People, if anyone out there listening, if you ask 5 people, have you had gum surgery? I'm sure you'll find at least one person who has. And they'll tell you how horrible it is, how painful it is, how anxiety-inducing it is. So for the listeners out there, if I'm just throwing a number out there. If you ask 5 or 6 people, have you had gum surgery? You'll probably find at least one who probably has. And most people are going to say that the recovery is a little unpleasant. It's a little, it can take sometimes up to a week or two, depending on what was done exactly and the severity of it. And so kind of going back to the main point, the developers were trying to find a way that we can achieve relatively comparable results and not have that patient fear. To do the LANAP protocol, you kind of have to be certified under these instructors, and that's kind of their motto is no fear. No fear. Right? Trying to return the fearful patient who may have had a procedure in the past and realized the recovery was a little rough, and they wouldn't want to do that again.
So you're saying less invasive, and we all know that the conventional surgery that was done to treat gum disease was not very pleasant. So you're saying I can go in there just like deep cleaning and don't get numb, and they're gonna just clean my teeth with laser, and I'm good to go?
Yeah. No. Once again, excellent question. We have to remember although we are coining the phrase less invasive to kind of describe this, it should still be regarded as a surgical procedure as it is. But when we do this procedure, you have the option of being sedated or not sedated. And your provider can definitely talk to you a little bit about the specifics about that. But we would still need to give you anesthesia. We would give you local anesthesia to make sure that you have no perception of any discomfort while we're working.
Okay, good. So you still get numb. It is still, of course, recognized as a surgical procedure, but less invasive because I know, of course, in a conventional surgery, literally we're kind of moving the gums out of the way before, clean and debride all the teeth, which was the best way to have access to clean all those teeth, all the bacteria that's in there.
Absolutely.
So does that also still include for us opening the gums and putting stitches in there afterward, like the conventional way we were doing it?
Yeah, great question. So when we talk about the LANAP protocol, that is not actually included. So you are not necessarily using instruments to move the gum tissue out of the way to visualize the roots. The laser can kind of do that in its own way without needing to physically use an instrument to move the gums off.
Okay.
And then to follow up, you were talking about if any sutures are needed. Well, the cool thing about this protocol is that since we are not physically removing those gums off of the teeth, there's no need for sutures at the end of the procedure.
Okay. So the body will heal itself on its own with the using the laser and everything else.
Absolutely.
Okay.
The body definitely does all the healing. I always have a belief that as surgeons, we kind of just guide the body where we want it to go, but the body does the healing and the body kind of does the regeneration. We just, as surgeons, I like to say we make intelligent wounds, and then the body does the rest.
Very good. So that's great. No stitches, less discomfort. I'm a patient coming to your office. What makes me need to receive a conventional surgical treatment versus LANAP?
Mm-hmm. Yeah, that's a great question. And I think, into the confines of this podcast here, we're having a conversation, and the idea here is to kind of get some information out. When questions like that are asked, those are going to be best tailored and answered by your periodontist. We have to remember, this is just kind of general information, but any sort of true tailored diagnosing or treatment recommendations are going to be best provided by your periodontist, who will do a clinical exam and take a dental history and look at all the other factors as well into making that decision of a diagnosis, and B, to follow up that diagnosis, appropriate treatment.
Very good. So for our listeners, make sure you visit your family dentist so they can see what's going on with your mouth, and then they'll let you know where you're at before they send you guys to us to evaluate. Okay, so let's talk about, you keep saying protocol, LANAP protocol. So again, why is it called a protocol? Why can I just get the LANAP procedure? Why do you say it's a protocol? What's entailed?
Yeah, great question. So I think, in this day and age, especially here in the 21st century, with technology kind of taking a forefront in our day-to-day lives, lasers are a new instrument or a new tool that is being implemented in any which way. So we're seeing lasers pretty much everywhere now. So the developers of this use the term protocol, or kind of define the procedure as a protocol, because it follows a specific set of sequence. So just because your dentist may have a laser, that doesn't necessarily mean that they're doing the LANAP protocol. We have to remember, once again, a laser is not a procedure. A laser is a tool. It's no different than a mouth mirror, or it's no different than, a probe that makes measurements. It is also another tool that we use, and we use that tool to our advantage. And in this case, not making an incision, not needing to put sutures. So because we have that laser, using it as a tool, we implement it. And then that protocol, once again, is a specific set of sequences that were developed by the developers and the engineers so that we can achieve an appropriate outcome. One important thing to note is that the LANAP protocol is the only FDA-cleared laser regenerative procedure that can actually has shown to regrow bone, periodontal ligament, and cementum. And by definition, that is true regeneration.
Which, when you say that, you mean what we're saying is that's the supporting structure
Correct.
of the teeth to basically be able to keep your teeth for
Correct.
as long as
So
you
all
can.
those fancy words that I just said is basically the periodontal lingo or dental linguistics of saying support to the tooth.
Okay.
Right.
Okay.
And so it is the only procedure that is FDA approved to do so.
So I know I have a lot of my friends, and I'm sure you do too, that they have lasers in their offices. So are you saying that it has to be a specific laser that's used for this procedure?
In this case, yes, it does have to be a specific laser. Okay. Once again, and it all goes back to the protocol following those sequence. The specific laser is produced by the dentist and the company that has developed this protocol. And so it must be from that specific company to utilize that. And once again, the only reason I'm saying this, I'm not here to push product, but following this sequence is the only one that is FDA cleared and FDA approved to once again show that it can regrow bone.
Okay, thank you. So my last question would be, any dentist can actually do this procedure, or do you have to go through some type of a education process before you're certified to do this?
Yeah, I mean, as one would imagine, this is not something that just anyone can just get this instrument and just start utilizing it in that fashion. Pretty extensive training, support, and certain certifications actually have to be accomplished so that you can provide this service. It is something kind of beyond the scope of just our day-to-day practice. And so once again, additional training and certification would need to be obtained prior to providing the service to patients.
Very good, very good. Well, that's wonderful. That's great information. We really appreciate it. I think that our listeners should make sure that if they end up seeing us, to ask about the procedures so we can go over that with them as well. I want to thank you so much for taking the time to see us and be with us tonight and going over the procedures. Really appreciate it. Thank you. And thank you again for watching our podcast. We really appreciate it. Always remember, healthy mouth, healthy body. Thank you. We'll see you soon.
Thank you all for listening to the Healthy Mouth podcast. As a reminder, the information we provided in this podcast is for educational and information purposes only, and it is not to substitute medical advice, diagnosis, or treatment. Please check with your family doctor or professional advisor before using any information provided in this podcast.
The Healthy Mouth podcast is co-hosted by Leo Applegate and Dr. Paul Towfighi. Our executive and technical producer is Johnny Flores, and our video producer is Aaron Zaragoza. A new episode is available every other Thursday.